Hello and welcome, everybody. I am so glad to be here, and I am so excited to be joined today by Amy Baldwin, who is one of the clinical educators for Ascend Hospice, to kick off this 12-part series on end-of-life care, palliative care, hospice care, and over the course of the next 12 months, we are going to be going deep into some of these ideas. And tonight is our first opportunity just to kind of broach and discuss what end-of-life care is, the different components of it, and what we need to be looking for, and of course, resources to try and help you in making these decisions and navigating these very difficult discussions. So without further ado, let's go ahead and get started on our introduction to end-of-life care. All right. So, of course, before we can get started, though, we need to always have our disclaimer. So, this information is intended, of course, for educational purposes only. And while I am a licensed physician, I am not acting in the capacity as a physician for this presentation. The content provided should not be construed as medical advice, diagnosis, or treatment, and always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions. Never disregard professional medical advice or delay in seeking it because of something that you have heard or seen in this presentation. And of course, no patient-doctor relationship is being established through this presentation, even though hopefully some of my patients are watching this presentation. Any and all decisions related to medical care should be made in consultation with a licensed medical professional. All right, now we got that boring stuff out of the way. Of course, Wellspring Healthcare, a little bit about me. So at Wellspring Healthcare, we believe in compassion, effective communication, and empowering education to transform lives. So that's why we do these webinars, to try and increase the educational component, to give you, the consumer and patient, the information that is necessary in order to help you make these types of decisions. So, of course, I want you to be able to reach out to us. So our medical assistant, his name is William, and he'll be happy to take phone calls and help to get you in touch with the right people. His telephone number is listed here at 816-708-1661. And if you are a leader at a facility and you like what you see here today and would like to reach out to Wellspring Healthcare, we are more than happy to try and help facilitate in any way. And please reach out to our Chief Operating Officer, Brandy, and she can help you at that phone number as well. And of course, you can follow us on our website as well. Now, because this is a joint webinar here with Ascend Hospice and Amy's joining us today, I wanted to make sure that we put up the Ascend contact information, because if something about this presentation resonates with you or a loved one, or you hear something today that you're like, I really feel like this patient that I'm taking care of in the facility would benefit from hospice or benefit from palliative care, I want you to reach out to us at Ascend so that we can then send someone back out to the facility. We can do an evaluation. We can help guide you through those processes. So please don't hesitate to reach out to Christina Cole at Ascend Hospice, and I've got her email there. We also have the website, of course, and the telephone number 816-584-8111. So very excited about that. All right, well, let's go ahead and dive into the introduction to end-of-life care. Now, before we get started, I think it's really important, and I loved this graphic that I found here, because this graphic I think is great. It starts out as a baby, and as we go through life, we transition throughout that life, and we all are going to go through one of these processes. Some of us may go through all of these processes. Some of us may have a different journey, but we are all going to be faced with end of life at some point during this journey. We can't all get out alive. So I want to first and foremost define what the umbrella of end of life care is. And so we often have palliative care and we have hospice. And Amy, I'm going to defer to you a little bit here, because I think that sometimes patients often get confused on these two different terms. And one of the ways that I distinguish them is palliative care. I think of patients that are sick and have chronic medical conditions, but that would benefit from continued treatment of their disease. Mm-hmm. Whereas hospice patients are patients that are further along in that process, and there's no viable cure for those patients. And so we should kind of transition our care. What are your thoughts on those two definitions, Amy?
palliative care is for those patients that still are receiving treatment. I would say they have the chronic conditions, and they can have a nurse practitioner, in our case, walk alongside them to help coordinate care, do further education. A lot of times when you're at the doctor's office, they talk about things and maybe you don't quite understand, or you think you grasp it, and then you get home and you're like, I don't really understand. Or you're having symptoms or something, and a nurse practitioner can come out and help educate and help manage those symptoms and kind of be that bridge between home and your medical professional in the office. Hospice is when you have a team of people that are coming out, walking alongside your journey of a terminal disease process, and help symptom manage and educate and really support you. We, you know, give you a big hug and help guide you along this process.
Oh, I mean, that's beautiful. One of the things that I heard as a continuous vibe in both of those that's going to transition real nicely into something we're going to talk about here is navigating. That
Mhm.
in palliative care, you help me to navigate the serious illness pathway that the patient is going through. And then in hospice, you're helping me to navigate that end of life pathway, which I think is just so important as well too. So wonderful. Now, thank you for that, Amy. That's great. That's great information. So, like I said, it segues us very nicely into the next topic that I want to talk about is goals of care. And I think that this is really where every decision needs to start. And I often tell patients we have to start with the end in mind, that we can't really make a decision until we know what our goal is. So just like in anything, if I wanted to be when I wanted to be a doctor, that became my goal. So I knew that I had to take science classes, and then I had to go to college, and then I had to go apply for medical school, and I needed to do research. I had steps that I knew that I needed to take. And so I was making decisions based upon that goal. And at one point I decided that I was going to stop playing water polo and swimming because I couldn't devote all of that time. And so I think it was a decision that was made with the goal in mind. And that's a very basic goal, right? But we have other goals that are going to change throughout our lives. And so when I often find patients that are starting to grapple with this, a lot of the time it comes because they've been diagnosed with that serious illness. They've been diagnosed with cancer, or they've been diagnosed with severe heart failure, or they've been struggling with, dementia, or senile degeneration of the brain, or something that's been severe that's going on in their family. And so they need to look at what are their goals of care. So if their goals of care are to continue to receive aggressive treatment in order to try and prolong their life, then that sounds like palliative care would be most appropriate in that situation, right? Because based upon what we just talked about. But I also think that if someone has progressed a little bit further, or they have that terminal cancer diagnosis and they've decided that they don't want to undergo chemo, or they don't want to undergo radiation, or they don't want to do surgery, and that's an okay decision. So often patients I come across feel that they have to do some of these things. And I think it's so important to empower patients to understand that, no, you don't have to go through anything. And so having a goal of care discussion is important in order to help make a decision about what you want to do. My dad, he always told me a funny story, Amy. I think you'll get a kick out of this. He's always told me that if he said, Brian, if I can't wipe my bottom, he said, I want you to take me camping. And he goes, I want you to make me some s'mores. And he goes, and then I want you to set me out to go hiking, covered in honey to be eaten by the bears. And that's my dad's funny, joking way of telling me what he deems as a high quality of life. Now, of course, he's joking. He doesn't want to really be eaten by a bear or things of that nature, right? But it clearly communicates to me what my dad feels is an appropriate quality of life. So we've had this goals of care discussion to a certain degree to be able to understand what he would deem as appropriate quality of life. So if I ever had to help my dad make decisions, I'd be able to use those frames of reference in order to be able to to help guide him down decision-making
Mhm,
pathways.
mhm.
Amy, what do you find patients often struggle with when they're discussing the goal of care? Do they often have a defined goal, or are they kind of open-ended, or are they not really thought about a goal of care in your opinion?
I mean, it depends. When we talk about hospice care, it's quality of life, right? But the goals of care, sometimes it's hard to define what my goal of care is when I've never journeyed with this disease. So that's where palliative care, hospice care can really come into play as us as healthcare professionals can start to talk about goals of care. And I think your dad's story is very helpful in starting of what's quality of life to you and working from what's the idea of quality of life, and then we can work to get to goals of care. Sometimes goals of care is a large um, thought that some people don't quite understand. We have to break it down a little bit.
I love that. I mean, and two, going back to the navigation from earlier, it's like, we can always start going down one pathway, and then as
Mhm.
that education develops and as the pathway moves, right, we can change our course of direction, and that's why it's a seamless transition from palliative care to
Mhm.
hospice as well too. So I think that it can really serve patients well to be able to get that extra education and that extra assistance in terms of helping them to navigate their disease process. So, no,
Yeah.
that's wonderful. All right. So, Amy, when do you find is the best time to have a discussion about these types of things? Is it best to wait until something happens and then we have to do it? Or when do you find is the best time for patients and families to have these types of discussions?
I think no time is better than the present. I mean,
I love it.
you just never know when life will change, when disease changes, and so really having goals of care and knowing um, what kind of life, I guess, disease process. But the earlier, the better, right? I just had a conversation the other day about advanced directives, and I said, bring it up just like you have here at Thanksgiving.
Mhm.
It's never too early.
Yeah, no, I love that. And I think you're so right. And it's important that we do, because we need to normalize these discussions, because like
Mhm.
we started out saying, it's like this is going to happen to all of us. And so but I think it's hard for a lot of people because it's facing their mortality, right? It's recognizing that we have, a finite amount of time. And so I think it's important to know that I want to live my life, and I know my patients that I've experienced want to live their lives that are consistent with their values as well as possible. And
Mhm.
so it's important to make sure that you're having those open lines of communication for sure. Well, Amy, you brought up a really good point that you mentioned earlier, a goals of care discussion and code status, and I think that's really important. I think this is another good discussion to have, because when we do get to the point of helping people with palliative care and hospice, one of the very first questions that we ask a lot of people is what their code status is, right? And I think that that's a very nuanced discussion. And as a hospitalist, as a post-acute care provider, as a primary care doctor in nursing facilities and long-term care and a skilled living or assisted living, I often ask this question of my patients every time that I meet them or we have a change in condition. And it's something that's very important, because I don't think that it's something that the nuance of it isn't discussed. And what I mean by nuance is that sometimes people will say, do you want to be resuscitated or do you not? And I don't think it's quite so black and white, because I think that we have to think about, what does a resuscitation entail? What is the likelihood of my successful, you know, survivability of that resuscitation, and what is my quality of life going to look like on the other end? And sometimes I have these, 89, 90, 95-year-old patients that have, 10, 12 comorbidities, and all of a
Mhm.
sudden they say, yeah, I want to be a full code. And I'm like, well, let's talk about that, because first and foremost, you weigh 82 pounds. And when we start doing chest compressions, we're going to break your ribs, and that's not something that we're trying to hurt someone, of course, but we're trying to resuscitate them. And so we end up sometimes breaking ribs, and we put tubes down someone's throat to breathe for them. And then, depending upon where they had this event, they may have gone without oxygen for an extended period of time, and they may have an anoxic brain injury. And, what does that mean? Because maybe they're not technically brain dead, or they don't meet that criteria. And so they have these very, a lot of gray area, I find. And I think it's very important to kind of be thinking about some of those things, because when we start having these conversations with patients, a lot of the time they'll be like, wait, hold on a second. You mean, like, I have a really low chance of having a meaningful recovery, like coming back to my current state? And I'm like, yeah, and on television, I actually did a study about this when I was an intern. When you look at television codes, 99% of people that code walk right out of the hospital, no problems. They go back to their normal. But in real life, it's totally different. Less than like 6% of people actually walk out, and only 25% of people actually survive the code. And that's a real challenge. And so I think it's sometimes important, because sometimes people see the do not resuscitate as a do not treat. I don't know. I mean, do you see that from time to time? They have this misconception that it's a do not treat.
Right. Yes. Sometimes we'll say, do you want a natural death versus a full code, right? Because by signing that DNR, people think you're just going to let me die, and that's just not the case. We're going to treat you up until and let a natural death occur, but we're going to treat you up until that point. Yeah, absolutely.
Yeah, no, absolutely. I love that, Amy. And it's so important. And too, I think it's going back to that person's goals of care, right? So if someone's is still in that point of, they're that palliative person, they're like, I want to live as long as possible, I want to keep going, push, then yeah, maybe a full code is the most appropriate course of action for you. But if you're kind of leaning towards, gosh, I have this bad disease, and my life is precious to me, and I want to be comfortable, and I don't want to create all of this trauma, in my home or for my family, or the pain and suffering that I might go through as a patient, then, but knowing that I'm going to be treated, I think is really, really powerful. So I definitely like that about the natural death. I think that's a really important piece to clarify with. Oh, great. Well, let's kind of summarize this up, because again, this talk today is just to kind of give us a dip our toe into the end of life care. And I think that we successfully did that by talking about that life is finite. There's different aspects of end of life care. We have palliative care. We also have hospice care. And, it's really important to have that discussion to determine which one of those is right with us. And creating goals can help us and our family to make the best decisions possible that are, of course, consistent with our own values. And I loved this little quote. That's why I wanted to make sure I put it in here. But a goal without a plan is just a wish. And so, it's really important to have an understanding of, we are going to, at Ascend Hospice and Palliative Care, we're going to help you as a patient, you as a facility, you as a practicing provider. We're going to help that team navigate this process. And I think it's really important to help that. And we'll help you to write the plan, because like you said, Amy, before, I think it was really, really valuable, is that we don't go through this multiple times. This is, one of those things that you go through once usually. And, unfortunately, some people have had to go through it with parents, and now it's, their opportunity to go through it. But, still that's a very emotionally charged time. And I think it's important to be able to move through that. So wonderful. So let's move here. So I really want to make sure that I take a moment to invite everyone to our part 2 of our 12-part series. And we're going to dive deep into palliative care and really understand what palliative care is going to do. And so just like you did this time, we're going to be able to register through wellspringhealthcare.org. And I'll have a link there, and then that will direct you to the CVent website. So really looking forward to that. Of course, let's keep in touch. Again, here's the contact information for Ascend Hospice, and again for Wellspring Healthcare. And of course, this video is going to be recorded and will be posted on our YouTube channel as well. And we will be able to link that through our website at wellspringhealthcare.org, and also at the Ascend website as well. So again, really excited and appreciative of everyone to be able to come in and join us tonight. I think I'll leave it with that. Amy, do you have any other final thoughts?
No, thank you for having me.
Oh, you're so welcome. And thank you for joining us. And I really appreciate it. And just an absolute wealth of knowledge. So really appreciate it. Thank you so much, Amy. Thank you, everybody.